Welcome, everyone, and thank you to those joining us live and to those listening in afterwards. I'd also like to warmly welcome all our guests, our moderator and speakers today. My name is Gizem Gülpınar, and I'm going to be the facilitator for today's session. I'm a pharmacist trained in Turkey. I'm now working as an academician in the field of social pharmacy at Ankara University in Turkey. I'm also the co-author of FIP Digital Health in Pharmacy Education, and I am delighted to facilitate this webinar today. Today, we are pleased to be delivering the digital event titled Digital Health in Pharmacy Education, Global Showcase of Initiatives from Pharmacy Schools. This is a special digital event series entitled Digital Health Innovating Pharmacy for the Future. We know that recent digital solutions have revolutionized clinical practice through all stages of health service delivery, from prevention to diagnosis, disease management, and monitoring. Pharmacists must keep abreast of all these emerging advances, to which immense capabilities will reshape healthcare worldwide. These events will showcase how a confident, capable, agile, and digitally enabled pharmaceutical workforce can be developed through education, as well as it can leverage the potential of digital health into a sustainable pharmacy ecosystem and tackle the challenges to usher pharmacy into its digital future. Here in this slide, we would like to share our event card to enable you to see all of our speakers and moderator in one slide before introducing them afterwards. Please note this event will be recorded live streamed on FIP Facebook profile and will be freely available on our website. To all those listening, please feel free to send your questions through the question box. And we will be picking those up throughout today's session. Now I'm pleased to introduce our moderator, Professor Lilian Azzopardi. Lilian is a professor and head of Department of Pharmacy at the Faculty of Medicine and Surgery of the University of Malta. She is chairperson of the Faculty of Doctoral Committee. Professor Azzopardi spearheaded major developments in pharmacy education, particularly in pharmacy practice, clinical pharmacy, and pharmacy practice research. She is also the core team member of FIP Digital Health in Pharmacy Education and the member of FIP AIM Advisory Committee. So it's yours, Lilian. Thank you.
Thank you, Gizem, for that very kind introduction. And I'm excited that joining us in this webinar, we have a very nice and large group of colleagues from different parts of the world who will be looking into this journey that we will see in the next slide, where we will have an outline of the program for today, which will give us the opportunity to look into 7 case studies from different countries around the globe, and they inspire us to reflect and share ideas and get back to our institution and look into how we can implement other aspects of digital health in our pharmacy education programs. So as we can see in the next slide, the learning objectives for this webinar are to learn about initiatives that are happening in different schools of pharmacy with a target to build digital health competencies in our graduates, and reflect on these good practices and examples and how we can get these examples and initiatives back into getting an experience and or improving our already experiences that we are already implementing in our schools. So this is a very exciting way of sharing, learning from each other and evolving in our pharmacy education programs. So I don't want to take much more time from this very hectic program we have today, and I'd like to pass on the floor to the first speaker for the session, Nilan Uzman, a pharmacist from Turkey, who is the International Pharmaceutical Federation lead for education policy and implementation, and the project lead and editor for the FIP Digital Health in Pharmacy Education report, which was launched earlier this year. On to you, Lilian.
Thank you, Lilian. Thank you, everyone, and welcome to our webinar. So before we jump into the case studies, I'll just make a tiny segue through a small journey about our report. First of all, last year in September, FIP has launched the FIP Development Goals. So this 20 development goals is the transformational roadmap for our profession to progress and respond to the needs of healthcare and to the population around the world. And as you can see, one of them, number 20, is digital health. So FIP Development Goal 20, digital health, is focusing on enabling, having a digitally enabled pharmaceutical workforce. This can be done through education. This can be also delivered through the practice from our practitioners. And of course, the application of digital technology and healthcare delivery needs to be supported with the appropriate science. So in order to respond to the needs of this digital health, last year we conducted a global research on digital health in pharmacy education and launched our report. And our report was launched in the beginning of this year. And we presented the findings through our global survey, which was completed by more than thousands of academics, practitioners, and students from 91 countries. So we have collected a lot of feedback and perspectives around digital health education from around the world. And the report describes the readiness, adaptability, and responsiveness of pharmacy education. And we also looked into the knowledge and skill needs of existing pharmaceutical workforce. And again, of course, one of the aim of our report, and we have our guests today who is going to deliver their case studies. We also outlined existing education initiatives on digital health from pharmacy schools. These are some Pathfinder case studies you are going to see today, and we showcase them in our report. And of course, with that strong evidence and the vision we had in the report, we think this is a great evidence base to integrate digital health in the pharmacy education and supporting pharmaceutical workforce so they can have the necessary skills around digital health, because it's the digital health has a very fast pace, and in order to catch that, we have to act now. So you have the QR code on the screen. You may scan the code. Also, I'll ask my colleague Gizem to post the link to the report on the chat box. Of course, this is an opportunity for me to relaunch our report in a sense, because after we launched our report in January, we have included 3 more case studies, one from Ukraine, 2 from Canada, and you'll be also having them today through our speakers. And of course, we have included FIP's Global Competency Framework, which has competencies around digital literacy and digital health, so that this can benefit our colleagues around the world to integrate digital health into their existing programs. So feel free to visit the report and learn more about the findings and where we are getting to. Of course, after we have done the report, there are 4 key way forward areas for us to act on. Of course, we have done the analysis and the findings, and this is leading us to a place where we have to act on them. And there are 4 main way forward areas we'll be focusing as FIP, and we are asking for your support to address all of them. The first one is capitalizing on the benefits of digital health. So we are advocating for a digitally enabled pharmaceutical workforce who understands, shapes, and delivers digital health in their practice. The second one is, of course, we are advocating for every pharmacist to be graduated with a baseline knowledge and skills on digital health. This is very important for our profession's future, and we are strongly advocating for that statement. And of course, there are countries that have already integrated digital health into their practice, into their education, and into science. we are seeking support from professional organizations in every country. So they became the advocate of digital health in their countries. So there is a policy around that to apply digital health in practice and teach it in pharmacy education. And the final one is that, again, we are supporting a digital enabled workforce, but how do we do that? So FIP is going to focus on developing necessary toolkits and resources for you, so you can go back to your countries and develop those skills in students and existing pharmacists, existing practitioners. So there are 2 key projects we are working on this year, and that is for the last way forward area for our report. We are currently working on a masterclass on digital health for academics. So this project is aiming at delivering the necessary digital literacy skills to academics, to educators, so they can teach digital health to their students. And of course, they can be the change makers to integrate digital health into their curriculum. And the second one is the FIP Global Curriculum and Training Resources Toolkit for digital health education. So we will also going to provide you some resources, so you can base your curriculum and programs on this toolkit. So stay tuned for these exciting projects. They are already being kicked off, and they are delivered by FIP's experts and volunteers in digital health and education. So I would like to also thank to our volunteers who are leading these important projects, and please follow us to get to know more about these important projects. Finally, this is an opportunity for me to invite you, as we are speaking about digital health today. Next week on 12th of May, we have a specific event on FIP Development Goal 20 digital health, where we will speak about how to develop a digital enabled pharmaceutical workforce, how to apply digital health in practice, and what kind of scientific advancements we need in our profession for digital health. I'll also ask my colleague Gizem to include the link to register for this event. It's free for everyone, so please do join to continue the conversations around digital health. Thank you very much, and I'll hand over back to Lilian.
So thank you, Nilan, for putting the context into the session today. I would like also to remind you that we have an active Q&A box. So after the first four showcase case scenarios, we will then have the opportunity to have a Q&A section. So please put in your thoughts and reflections or comments in the Q&A box. So now it gives me great pleasure to start our world tour and introduce Dr. Felicia Williams, an active pharmacist in Nigeria, and she is a fellow of the Pharmaceutical Society of Nigeria, coming from the Department of Clinical Pharmacy and Pharmacy Practice within the Faculty of Pharmaceutical Sciences at the University of Ilorin in Nigeria. And on to you, Felicia.
Thank you so much, Lilian, for that fine introduction. Good morning, good afternoon, and good evening, everyone, wherever you are in the world. I'm delighted to meet you. I wish to express my appreciation to FIP for the privilege to present this case study from Nigeria in the African region titled Digital Health and Pharmacy Education in Nigerian University. The faculty, as shown in the picture there, was founded in 2009, while the university was founded in 1975. The faculty representation there includes the dean, Dr. M.O. Amali. We have heads of department, staff, and students. While the principal officers as shown, Professor S.A. Abdulkarim is the vice chancellor, while Professor S.O. Malomo is the Deputy Vice Chancellor, Academics. Professor B.F. Sule is the Deputy Vice Chancellor, Management Services, while Professor Buhari is the Deputy Vice Chancellor, Research, Innovation, and Technology. The registrar is Dr. Mrs. Olowoleni. The university librarian is Professor A.O. Issa, and the bursar is Mr. O.H. Sunday. The question is, what is digital health? Digital health is the merging of digital technologies such as information, communication, and data analytics with health and healthcare elements, living and society in order to increase the effectiveness of healthcare delivery. Digital health has impacted positively on both the healthcare providers and patients, which has resulted in improved access to health services, increased quality of healthcare, reduced healthcare costs, personalized medicines. The digital health technologies include telehealth, wearable devices, personalized medicines, mobile health. And the area of application of digital health include research, such as treatment adherence, treatment itself, such as chronic disease management, and public health, such as medication tracking and safety. The pharmacy profession also has evolved from product-oriented care to individual patient-oriented care and population-oriented care, which is public health pharmacy. Pharmacists are thus enabled to implement pharmaceutical care interventions through the use of smartphones and mobile apps that supplement daily medical references. This has necessitated digital health education in pharmacy. Next slide, please. Next slide. Now, what is digital health? Education in the University of Ilorin. We find that while digital health is not taught as a course, we have different aspects of digital health that is taught as various aspects of different courses in the B.Pharm, PharmD on the master's program. For instance, we have pharmacotherapeutics, pharmaceutical care, pharmacoepidemiology, pharmacovigilance, drug information and pharmacy communication, ethical dispensing, clinical clerkship, and ward round being taught to these students. And these students also undergo training in this area, experiential training in these areas that have been mentioned as shown in the various pictures there. Next slide. So what are the outcomes of the training of our students? With the assistance of smartphones, mobile application, and the various digital health related lectures, students have been able to undertake pharmaceutical care of inpatients. At the end of each ward posting, students make clinical case presentations and they submit a written report of these presentations. The students are also privileged to make clinical case presentation at one of the clinical meetings of the Clinical Pharmacists Association of Nigeria, CPAN. CPAN is an interest group of the Pharmaceutical Society of Nigeria. Another important outcome is the production of pharmacists that are equipped with professional skills and competencies for optimal patient care and outcome. One of the pharmacists trained in the University of Ilorin, pharmacist Ayobami Dialu, has developed a mobile application called Micro Big Pro, which is useful in establishing antimicrobial stewardship programs in hospitals. This program has been useful in overcoming rational drug selection, in ensuring rational drug selection and stemming the tide of antimicrobial resistance. Definitely this program, this app would transform healthcare delivery. Now, with accelerated speed and complexity of digitalization of health, pharmacy education curriculum or curricula should be reviewed, restructured to include digital health as a course on its own, rather than being sandwiched in different courses. Digital health should contain relevant components, spectra, and taught from the beginning of the program to the end. This will equip pharmacists to acquire relevant competencies in health, digital health, and perform optimally in healthcare delivery, especially at this period where the whole world is ravaged by COVID-19 pandemic. Thank you. We want to appreciate the University of Ilorin and its management, the Faculty of Pharmaceutical Sciences, the hospital, the students that's engaged in the learning, and everyone that has made it possible for this digital health training, and implementation of digital health among our students. Thank you.
Thank you, Felicia, for giving us an overview of an opportunity to include digital health competencies in pharmaceutical care for inpatients. Very, very exciting. And now I would like to move on to our next case example, coming from shared from India, and introduce our next speaker, Professor Neeraj Upmanyu, who is the Dean of the School of Pharmacy at the People's University in Bhopal, an active pharmacy profession advocate in the Pharmacy Council of India. So thank you, Neeraj, for sharing this experience.
Thank you, Lilian. A happy morning, afternoon, and evening to one and all who have been connected here for this program. And I would like to thank FIP for providing an opportunity to share our thoughts on this. We were going through this pandemic for the last 1 year, and India is also one of the most affected country. And there was a little bit challenge because we were going through the transformation phase as far as this digital health is concerned and as far as this digital education is concerned. So we were having both the parts. So we have to manage both the things, digital health as well as the education pharmacy with the digitally. So it was really a great challenge, and it was a tremendous challenge for us, that how we can respond through this transformation. Next slide, please. So here in this particular slides, I would like to present that digital literacy was one of the challenge, which is the ability to steer through various digital platforms and understand, assess, and communicate through them. Because we have to communicate to our students that how we can take this challenge and how we can further move up with this facing this pandemic. And imparting education online is the new normal now. And revamping the education sector is crucially, especially the higher education institutions. So our School of Pharmacy and Research, People's University of Bhopal for Pharmacy initiated this digital literacy program as a mission mode. And basically the objective of this program was to enable pharmacy teaching staff and students with continuous learning and developing of digital assets and contents. So we have the intention that the education should not be affected. And program was successful in developing the culture of digital literacy at the School of Pharmacy and Research. Next slide, please. Next slide, please. And the description, educational description which we have taken, that was designed was, and the major components was development and enhancement of digital literacy and development of digital content. Because the contents were very important, because physically the students were not coming, and we have to impart the education through the digital mode only. So that was in our mind, and how we can move ahead with this thing, because the students were not so acquainted digitally, because they were in the mode of physical mode only. So it was a really great challenge. So we think of two major components. One was to move ahead and develop and enhance digital literacy, and another one is how we can develop more and more platform digitally. Next slide, please. And methodology which we have adopted for this is the gap assessment, which was very essential and critical component in this program. Team of experienced professors, PhD scholars, and technical experts was formed to review the available digital content and suggest the new modules. Both basic digital literacy training program was designed for the staff, and we have to cater the needs as per the assessment, and development of digital contents on the basis of student profiling, instructional strategy, scripting, and audiovisual modes. And there was some prototype module for digital content were developed, and based on this workshop was also conducted, and we were sensitizing the students for this program. Capacity building was also one of the major factors for both intellectual and infrastructural capacity was developed, and we have taken feedback into consideration. That the whole consolidated feedback mechanism was designed for digital contents, and we were improving our digital contents as per the feedback mechanism which we were getting, and we were providing to the students. Next slide, please. And some of the health, because another aspect of this case study was how we can move ahead for this health, digital health, and how we can cater with the help of our educational infrastructure, uh, the students and the great force which we have. So we were having some online digital health awareness program and activities. We were doing some activities with the help of videos, and we were uploading onto the websites, and we were sharing with all the platforms. So one was video by students of School of Pharmacy and Research, People's University, on the significance of washing hands timely on Global Hand Washing Day, that was 2020. And online video was also made on basically by the students for food that value natural usefulness, curative properties of garlic to create awareness among people during COVID-19 period. And this online coronavirus infection awareness video program was also launched on 15th and 19th April. So we were trying to sensitize the society and how they can take care of themselves, how they can use the Ayurveda more. So basically our this program which we were conducting, to the motto was how we can sensitize. I would request to kindly play the video, please. Next slide. These were some of the programs which we were doing. These were some of the programs while like we were celebrating the World Pharmacist Day, World Health Day. We were sensitizing about tuberculosis also. Because of this pandemic, the people were confused between this coronavirus infection and tuberculosis, because lungs were the most affected part. And Mrs. Manjari Kharat were one of the speaker who is the vice president in FIP. So we were trying to sensitize to our students, to the society also, how they can sensitize to the society and they can help our nation. I would request one video which has been prepared by our students.
Hello all. Today we, the students of SFPR People's University 3rd Year, have come forth to tell you about the natural way to good health. Hippocrates said that there are illnesses that can be treated by nutrition. Hence, going forward with this saying, we are going to tell you about the natural benefits, food value, curative properties, and some remedies from garlic for different diseases.
In herbal medicines, garlic is traditionally used for the ailments such as asthma, a condition in which persons make it difficult to breathe. Secondly, used as a bronchial congestion, a condition in which fluid and mucus is accumulated in the lungs. And garlic is also used in arteriosclerosis, a condition in which arteries walls is become thick, and also used in gallbladder troubles. It may cause nausea and vomiting. So the unpleasant odor in garlic had been traced to its mineral content. This mineral content had been greater in volatile oil of garlic, which had marvelous therapeutic value. Thank you.
Analysis of garlic shows the high content of minerals and vitamins. It also contains traces of iodine, sulfate, and fluoride. Garlic also contains a volatile oil called allyl sulfate. Medicinal properties of garlic depend on this oil. Garlic is also used as a strong antiseptic agent. So I recommend you people to please try every possible remedies at home and stay at home and be safe. Thank you.
I am explaining about disease called rheumatoid arthritis. So, first you all should know what is rheumatoid arthritis. It is a disease which causes intense pain and inflammation, also stiffness to the joints, which get worsened by the ages. So I am here to explain you about some home remedies which get you relief, like clove and garlic paste, which you can put in the swollen area, or even you can use the oil of that so that it would absorb easily onto your skin and enter into the bloodstream and also get you relief. Thank you.
Remedy for common cold: garlic.
So this is how these are our B.Pharm students who prepared these videos, and this is how we were trying to help the society, and this is how we were doing all the small things to cater our society and to help in this pandemic. Thank you once again for providing me this opportunity. Thank you.
Thank you, Professor Neeraj Upmanyu, for sharing another perspective of how we can empower our students to communicate through a digital platform and empower patients and give information about health and pharmaceutical aspects. So now I would like to invite our third speaker, Dr. Mohammed Hassan Al Naim. We're moving on to Malaysia, and Dr. Al Naim is a member of the Department of Pharmacy Practice at the Faculty of Pharmacy of the International Islamic University, and an active member in the FIP Academic Pharmacy section. And I would like now to pass on the floor to Dr. Al-Naim.
Thank you so much, Professor Lilian, for the kind introduction. And thank you, FIP, for giving me the opportunity today to present our case. We're titled Development of Digital Literacy Competencies Among Educators and Students in our university, a public pharmacy school in Malaysia. In the background, actually, maybe a universal challenge faced by almost all the pharmacy school once the pandemic came in March 2020, regarding how to proceed further with the learning process, regardless the readiness level of the staff and the faculty. In our scenario, despite we have well-established learning management software, we were faced by the challenge that among all the courses, only about 30% of the courses were fully digitally developed, so they can proceed with no problem. The rest, of course, was a bigger challenge. In addition, we initiated a survey to assess actually the readiness between all the stakeholders, educators, administrators, and students. And we found more than 50% were not ready at the moment to proceed immediately to the digital learning or the digital transformation. So we realized at this point of time that initiatives, an urgent initiative should be prepared, adopted, and implemented rapidly for us to maybe proceed further with the learning process in this new normal. Next slide, please. What have we done? This slide actually all the flow, what has been conducted over a 3 months period, starting from March 2020, when we have a team of the digital educator recruited among all the faculty staff based on the interest and the experience, both of them. This team was responsible for putting a plan, what actually is needed to proceed further with the learning process in the new normal, in terms of maybe the competencies needed, focusing on the courses or the learning delivery and the assessment as well. At the same time, we realized that our learning management software needs some major revision, which has been conducted to be more inclusive and more convenient for all users. We didn't neglect actually the impact of the pandemic on the students. So we worked closely with our students to see what are the challenges faced by them during this pandemic and how we assess them to proceed further. And if we cannot solve the problem maybe remotely, we arrange for the students to be back on campus so we can further assess them better. On the educator perspective, it was a series over 2 months, a series of digital learning clinics, covered all the digital tools, platforms, the approaches to proceed with the assessment in a sense of reliable, fairness, and of course, acceptability of the assessment from the student side. For the students, also some sort of assessment and the training, trial runs, and on different digital platforms. And for any activity like the virtual learning, virtual assessment, for each particular assessment, we prepare a protocol that specify very details what actually the students is expecting from this particular activity. Later in June 2020, we were able to see initial digital transformation among all the courses taught in our faculty. And at the same time, both the educators and the students are ready to proceed further in the new normal by a full digital learning plan. Next slide, please. So at this point of time, if we want just to maybe to summarize what we have learned from this experience, first point, we have learned that a needs-driven digital literacy training for both the educator and also the students was able to foster and improve the digital confidence and competencies, and is actually achievable. But we have to take, or we have learned also that to maintain this digital transformation, we have to set a dedicated support team among the faculty staff to further investigate all the updates. Some situations need alternatives to be provided for us to sustain and to maintain the digital transformation. The challenges that we faced and that we are currently working on, of course, to maintain the reliability and the fairness of the individual assessment, especially for graduating students and the clinical components, was actually a big challenge. The era of many digital tools are there, so we are aiming to try our best to streamlining the number of digital tools, so it is maybe more likely to be acceptable on the long term and more convenient, of course, for the students. And the third and last point, the challenge of enhancing or improving further the efficiency of the digital learning. As I mentioned, we have focused to a great extent on the delivery and assessment. Of course, there is a lot more to be done with the digital learning in this era. So we are currently working on how we proceed further to improve the efficiency of digital learning. And that's all about our case. I want to acknowledge my co-author for this case study, Assistant Professor Dr. Lilian, the Deputy Dean Academic in the Faculty of Pharmacy, International Islamic University, Malaysia. Thank you, FIP, for the opportunity. And back to Professor Lilian. Thank you so much.
Thank you, Mohammed, for sharing your experience in Malaysia. And I think it was a very effective reflection that, that you highlighted the need for a dedicated support and collaborative approach. I would like now to move on to our last case example for prior to the Q&A session. And the next example is coming from and is being shared by a colleague from Ukraine, Professor Irina Nizankovska, who is the Dean at the Faculty of Pharmacy at Bogomolets National Medical University. Professor Nizankovska could not be with us at this during this live webinar session, so we have here her contribution and case discussion shared through the next video.
Hello, everybody. My name is Irina Nizankovska. I am a head of Department Pharmaceutical, Biological and Toxicological Chemistry at Bogomolets National Medical University of Ukraine. A modern development in pharmaceutical education requires the use of information and communication technologies as a part of a future pharmacist professional competencies. The aim of this case study was to analyze the level of information competence of third-year pharmacy students at the Bogomolets National Medical University of Ministry of Health of Ukraine, and to determine how to improve the informational competence of students studying their biological chemistry. To assess the level of students' information competence, we conduct an anonymous survey among third-year pharmacy students. They answer a questionnaire which contained 9 questions on the topic: sources of information for students' independent work to prepare for the biological chemistry discipline. The obtained result show us that 90% prefer the Google search engine and the YouTube channels to prepare for the practical class. 18% of students use didactic materials that are posted on the official web page of the department. And 35% use electronic textbooks and video lectures. To find information, 50% of students use sites with the domains gov.ua, edu.ua, nmu.ua. Also, 50% of students prefer illustrations and 20% choose websites that are present first in the list of proposed sources. As a result, it should be noted that 85% of students felt the need of consult with teacher. 50% were not satisfied with information found on the internet. The reason, in our opinion, it's dominant principle behind which students choose a reliable source of information, namely text understanding. Among respondents, 35% considered scientific sources of information useful for self-preparation, but 2% noted the difficulty of comprehending the text in scientific publications. Experience shows that about 30% of first third-year students are able to independently work with internet sources of information. 98% indicate that they want to use internet resources to prepare for the classes, but only 5% of respondents believe that internet resources are not practical and useful. We conclude that developing information competence requires teachers to make appropriate changes in the educational process associated with the revision of traditional methods, technologies, and teaching aids. Also, it is necessary to include in a biological chemistry curriculum a component that ensures that future specialists in the pharmaceutical industry can competently navigate information and apply it to solve emerging professional problems and enhance self-education. Thank you for your attention.
So that has seen us through our first 4 examples. And at this stage, I would like to invite Gizem, who is monitoring the Q&A box to
thank you, Nilhan.
This discussion.
Thank you, Lilian. So thank you for these inspirational presentations for our speakers. Now we have a short Q&A session before starting part 2 presentations. So if you have any questions or any comments that you would like to share with our speakers, please type them using Q&A box, and we will pick them up as we progress in this Q&A part. Now, I would like to ask Nilhan, Felicia, Neeraj, and Mohammed to keep your cameras on while I'm picking up some questions. We have some great questions and comments, so thank you everyone for sharing your thoughts, and we really appreciate that. If we don't have time to answer your questions live, please wait until the second Q&A session. So there are some questions from Mike Dejos and Inci Kayın. I am for sure that they are similar questions, so I would like to combine them in one question. they are saying that how do you train your preceptors on digital health so they can show your students of its application? So they are wondering how you are providing the trainers education to enable your trainers to fully able to give this digital health education. So who would like to start first?
Can I start, please?
Yes, Felicia.
Yeah.
Please.
In the University of Ilorin, we have preceptors who have been retrained in the FAMD curriculum. We have a situation where pharmacists that have BPharm have gone for further training in FAMD. And with that training, they have been exposed to digital health applications and skills acquisition competencies. And with that, they are able to impact them into the students. One of them is shown in the slide where the preceptor is carrying out drug information activity and is able to impact them properly. In one of the slides, I also showed a webinar announcement where the moderator is also trained in FAMD. The other moderator to Dr. Ole, also trained in FAMD. So all the preceptors have that training in FAMD that has enabled them to have the necessary competencies and skills acquisition to enable them impact digital training skills in the students. Thank you.
I would like to, Jisem, I would like to speak something.
Actually, Lilian, you can decide which speaker would like to answer.
Yes. I believe Neeraj can share. Maybe we can have a round table discussion. So we can move to Neeraj, and then we could have reflections from Mohammed as well. So on to Neeraj.
Yeah, thank you. Actually, there was two-way process of preparing the students. So first of all, when this transformation of digital education was started, and we were going through all the things through digital mode only. So first, as I told you, we prepared the group and we were sensitization to the pharmacy staff and to professors as well as our PhD students. And then we went to this transformation to the students. So slowly and slowly we were trying to sensitize them. We were trying to acquainted them how beautifully they can execute using this digital platform. And once they acquainted with all the how we can utilize these digital platforms, then slowly and slowly, as per the demand of the conditions, as per the pandemic which is going on, so slowly and slowly, whatever the things which were coming and some of the requests from the government of India which was also coming, so they prepared small video. We motivated the students, we provided them some small topics that how we can sensitize to the society, like hand washing, in what way they have to use this technique to hand wash, and as well as just like that, because we have a very good strength of Ayurveda. So we try to sensitize the people that how they can use this Ayurveda for this particular therapy and to cope up with this pandemic. So that is how we prepared our students, and they prepared accordingly and they passed on to the society. Thank you.
Mohammed, do you have some thoughts which you'd like to add on?
Just a small piece of information. Just in our setting, I think maybe very relevant to training is to define the need, or what actually the competency needed, and what sort of activity, different activity, sometimes hands-on training, sometimes workshops, some very different training, and this actually can be for the staff, for the faculties, can be compacted in a very maybe condensed program. And this program maybe assess knowledge, skills, and at the same time, the staff will come up with what actually the digital literacy or the competency they can transfer to the students. So in the first place, we have to define what is needed in the education, of course, for the students' perspective. And of course, for the practice will be the patient perspective. This my sharing in this one. Thank you.
Thank you. Do we have other grouped questions, Gizem, which we could tackle in this Q&A session?
We have a question from Margaret. She's saying, like, I'm interested in pharmacy informatics. What training opportunities are available?
I can jump in here to mention about our masterclass project again. We currently the masterclass and training opportunities we are going to provide will be for academics. So it will be provided to educators who can then go back to their institutions and teach those courses. So our master class or training programs here at FIP is not focusing on pharmacy informatics specifically, but in our report, the case studies we are going to cover will also have much more interesting case studies in the second part of the webinar. So we have 13, 14 case studies from around the world on programs around from pharmacy schools on how they teach pharmacy informatics or digital literacy skills, etc. So those could give some example on how these courses are delivered, and then our offerings will be targeted at educators so they can go and teach. But on the other hand, FIP has a technology forum, who's a group of experts around digital health and technology. So they are also releasing some resources and some guidance around digital health and specific topics around practitioners. So you may continue following up FIP and our notifications and communications. So this can give you our participants and Margaret some idea.
Also, as an add-on to this query, I believe that in our next session, Dr. Dixon Thomas, who comes from the who has experience in the drug information clinical setup, will be sharing some reflections that relate to our questions. So just to give a glimpse into that. And maybe there is another question, Gizem, which I'm seeing in the chat box that probably is shared by many of many of the audience, is to what extent, and maybe it's a general question that our speakers who have shared their experience can reflect on. To what extent should the educators and the students get basic knowledge into applications and the software linked to health, as opposed to empower them for digital health sharing? Maybe you could give us some reflections. What should be the emphasis in terms of the coding, software, familiarity, as opposed to an emphasis on the competence in digital health? And I open the floor to any thoughts from our speakers. I note Jaime. Yes, please.
If I may, thank you for letting me jump in. I'm a practitioner actually, and I'm not an academic. And I think that pharmacy students and pharmacists should have enough knowledge to firstly let them know the potential of digital health that brings to our practice, how our services and patient health and economic outcomes and basically all the outcomes that digital health improves. What's the potential? Because we saw in the report that was introduced to you that there's still a lack of knowledge in the pharmacy profession. We are mostly based into those digital health tools that allow a more efficient workflow in pharmacies. So it's not really complex tools that are the most transformative. So to answer the question, we should have enough knowledge to know if tools are evidence-based, if they respect regulation, and from an ethical point of view, if it's good and safe for the patient and the health system. So I don't believe we have to know in deep every single tool. I saw someone who was asking about coding, for example. I don't think we have to know about coding. That's another step, and I would be more than happy to know that. But based on the lack of resources that we have, we should know enough just to know if we use those tools or not. That's it, as a medicine in our practice. Thank you.
Thank you, Jaime, for sharing this perspective. And especially, it's also important and very relevant for pharmacy educators to share these ideas with practitioners. So, because unless educators are also working with the practitioner group, then the involvement and the transformation cannot be relevant to what is actually needed for the pharmacy profession. So thank you for that very valuable insight at this stage. I believe in the interest of time, we now have to move on to our second part of the session and move across the next case studies. And we will have another Q&A session at the end of this. So please keep on posting your Q&A sessions, questions in the box. And it's my pleasure now to move on to another colleague, Dr. Dixon Thomas from the United Arab Emirates. He is an Associate Dean at the College of Pharmacy of the Gulf Medical University. And as I have already mentioned earlier, also a director for the Center for Drug Information at Mumbai University Hospital in UAE. On to you, Dixon.
Thank you very much, Lilian, and thank you, FIP, for letting us contribute to this report, vital report about digital health. And I did contribute a case study from UAE with Professor Sharif. Professor Sharif is our Dean, College of Pharmacy. Right. Let's move to the next slide. Yeah, this is our academic health system, where you can see in the middle is the Gulf Medical University, surrounded by 3 hospitals in the same campus. There is a rehab hospital, which is a small one in the front side. In the middle is Danta Hospital. On one of the side, maybe, yeah, the right side is the big one is a general hospital that's having like currently 350 beds plus multiple specialties. So it's being one campus, and the Mumbai labs is actually situated inside the university building. Also, we have in College of Pharmacy, there is a sterile compounding lab that is also helping the hospital. So what is understandable very well is so good integration of practice as well as education. So there were some questions in the chat box that we are speaking about education or healthcare delivery. In our case, I should say, in many places, when students are posted in hospital, maybe from early clinical exposure to introductory pharmacy practice experience and advanced to pharmacy practice experience, it's all kind of like, practice is happening at the same time. And many practitioners are teachers. So what happens is like, empowering everyone, including the practitioners, and providing more of digital health services and teaching them how to do that is fundamental. So we have a great context here again to focus on. Our case study on this FIP report was focusing on interprofessional education as well as care. I say again, it is a little bit inseparable in our case, as education and care is happening at the same time. Students are involved in patient care also. Right, so digitalizing, it is happening at different levels. So from next slide, what I can show is we were waiting for many years as part of our interprofessional education activities to start very early stage interprofessional education from year 1. But, training or grouping these students, kind of like when we add all these programs together, it's more than 400 students at once, making them to different groups and training them at once is very difficult. They cannot keep coming to hospital. Imagine if 400 are coming to hospital at once. Then, of course, again, at times of COVID pandemic, it's a big problem. So what we actually did is, that time we had to digitalize the interprofessional education activity, and it became very comfortable to do that. So practitioners came online and students came online. We made different groups. They were given with videos of hospital tours, as well as many practitioners came on live and spoke to students in big groups, as well as then they separate to small groups and discuss about interprofessional care. And these groups were actually mix of students from different specialty. So they learn from each other, they learn from professionals of different backgrounds, and it is a wonderful activity, which was very successfully completed in semester one. You can see with good response rate of above 80%, and satisfaction rate is skyrocketing above 90% for all these groups. It's above 90%. So next slide, this particular project is continuing. Now in semester two, they are applying in different cases, which are again interprofessional care cases crafted by practitioners, also moderated by practitioners. This is a wonderful success experience, and we are invited in one of the regional conference to speak about that experience, what we have in digitalizing and integrating care and education together. Another wonderful thing is a high fidelity simulator, which is created by our very own Chancellor, Professor Hossam Hamdi. This high fidelity simulator is having actors from the UK, and they were recorded with their sessions, and with artificial intelligence, when we give prompts, they will respond the recordings. So at times of COVID lockdown, it was essential. We have to continue our experiential training as well as assessment. So there was a question, how can we assess from a distance? Students are locked up in their apartments, faculty is in their apartments, and we have these virtual patient cases. So everyone joined online, and then we actually run this video. After seeing this video, students were asked to counsel these patients mainly about their drug disease, like Neeraj show some of the videos where students are educating. So that educational activities were performed by students and faculties there. They evaluated with the rubrics, which is already shared with students in advance. So we evaluated the content, clarity, focus, and empathy, which is there in the counseling, which is one way at this point of time. But it was short instructions which pharmacists used to do. And we could publish that on FIP Pharmacy Education Journal. It's a very big success story. We are so happy of. Also, this software or this simulator, what we have is having more than 30 cases, which can be modifiable with different case scenarios. That is a wonderful learning and capacity building, how to take care of patient from a distance. That again, incorporated to education and very much in the practice context. This is another success story we have. And also our chancellor was invited by the Ministry of Education to give a demonstration about this software to all the other colleges in UAE. We are very proud of this. Next slide, please. Of course, training experts and faculty, because they had no great education about digital health or interprofessional care or drug information, evidence-based practice. These backgrounds are not there for practitioners who are already responsible for training such things to students as it is in our curriculum now. So we have no other choice than training the preceptors also, training the practitioners who are not preceptors also, because a culture of evidence-based drug information and interprofessional care should happen among practitioners. So the first course was introduced. You can see Professor Sharif sitting here with a blue blazer, and next is Dr. Fosi, who is our medical director in Tumbe University Hospital. Next is me. And then we can see Dr. Shabazz, who is head of Department of Clinical Pharmacy. And we have some clinical pharmacists here, doctors here, and nurses here who took the course, which was for a month. All were in the hospital, but sitting in their consultation room or practice area, but the course is online. Okay, so this again fundamentally improving abilities of people to communicate, digitally, and speak about health, speak about how they deliver health. All these competencies, multiple of them, those need to be segregated and analyzed, of course. But such training is very useful. 30 completed now. We are going to repeat it multiple times so that more practitioners are digitally capable of providing this better education, as well as improve their practice also, because they should be benefited from the whole process. So all are in win-win situation. This is the success story and case what we want to share from Gulf Medical University academic system at Tumbe Group and UAE. Yeah, thank you very much.
Thank you, Dixon, for sharing another very exciting success story, and particularly for getting on the table the concept how we need to also look into interprofessional education also through the digital platform. I really liked this concept, which is, as we all agree, interprofessional education in pharmacy needs to be at the forefront, and merging it with this digital idea is a way forward as we move ahead with the opportunities in the digital world. So thank you, Dixon. So now we can move on to Canada. And it's a pleasure to introduce pharmacist Janet Cooper, who is the Executive Director of the Association of Faculties of Pharmacy of Canada, who will share experiences from the Canada case study.
Thank you, Lilian, and good morning, everyone from Ottawa, Canada. I really want to thank FIP for inviting me to present to pharmacy colleagues from around the world and share what Canada has been doing in the area of digital health education. Association of Faculties of Pharmacy, we represent 10 schools of pharmacy across Canada, and we have about 5,300 students across the 4 years in the 10 schools. So about 7 years ago, AFPC created and launched a national competency-based e-resource that we call e-learning for healthcare professionals. And certainly with the challenges of the pandemic, these online courses have been even more valuable than they were before, as all our Canadian schools have been teaching virtually since last March. Just for some background, at the time that we started to develop this in 2012, we only had 2 of the 10 pharmacy faculties that were providing education on health informatics, that's what we call it, or digital health. And there was an identified gap in expertise to teach in this area, and also a lack of dedicated courses and information to support the instructors. So recognizing this gap, in 2012, AFPC received funding from Canada Health Infoway. And Infoway is the national federal agency that's been funded to implement to develop and implement electronic health records and electronic prescribing across the country. And our goal in developing these programs was to really improve pharmacy graduates' preparedness to work in technology-enabled environments by integrating digital health into the curricula at the 10 schools of pharmacy. So we have an open access Moodle e-learning platform that features both the informatics for pharmacy students e-resource and a couple of interprofessional modules. and the program is free for all Canadian pharmacy schools to use. I really want to recognize the academic lead for this project and also our instructional designer and also an author of several of the chapters, who is Marie Roque from the University of Toronto. The other thing we did was establish a pharmacy educator peer leader network after the e-resource was developed. And the network really was to promote awareness, provide mentoring, and facilitate uptake of digital health into pharmacy education across the country. So the network has one representative from each of the schools, and Lisa Bishop is the peer mentor lead from Memorial University in Newfoundland. We also established an informatics special interest group for other Canadian faculty members who are interested in e-health, and that group meets on a regular basis. Next slide, please. So this is more detail on our Informatics for Pharmacy Students e-resource, which was first launched in 2014. It is competency-based, so the first phase of the project was to develop and validate a competency framework related to the use of information and communication technologies by Canadian pharmacy graduates. And we developed 3 competencies with 31 indicators, and the full report is available on the AFPC website. So you can see here the list of the 18 chapters that we have on our e-resource, and it was written by pharmacy faculty members and clinicians, and the content and the format was intended to engage pharmacy students using very media-rich material, videos, innovative learning activities, and patient cases. And it was designed so that it could be used sort of in its entirety, or they could use just certain chapters within WIN courses, and to also support faculty members. So for each of the chapters, and I have one of the electronic medication reconciliation one as an example there, the students have to complete all the sections and their progress is tracked. They don't have to do it all in one sitting. They can come back. Once they complete it, they have to do an evaluation, do a quiz, and then they receive their certificate of completion, which they can upload into their university's learning management system to prove that they completed it. We also have 3 of these chapters that are available in French. In terms of how it's currently used, some of the schools in Canada have a specific health informatics course, and they use many of these chapters for those courses. But other schools will select certain chapters and assign them across different courses. And the FIP report also includes a case study from the University of British Columbia that describes their 2-credit pharmacy informatics course, which is a standalone course. So the key goal for our e-resource was to continually update it and expand it. So we've added more chapters over time since it was launched in 2014. We've also modified the other chapters and reorganized it. And this has resulted in several different versions and up-to-date content. And we're also now in the process of revising 6 chapters. Most of them will be for interprofessional use. And we actually have a new one that will be on virtual care. Next slide, please. So we have actually an interprofessional module that has 2 courses right now, one on electronic medication reconciliation, and the other one on electronic prescribing. And these are also used in medicine, nursing, dentistry, and pharmacy technician programs in Canada. Our e-prescribing course is the newest one, and we developed it using new software. We think it's more engaging and visually appealing and interesting for the students to take this course. And one of the reasons we focused on this is Canada is behind many countries in electronically transmitting prescriptions from a prescriber software over to the community pharmacy software systems. It is a big priority in Canada, so we received additional funding from Canada Health Infoway to support to develop educational programs to support electronic prescribing. So this course really focuses on safe and effective e-prescribing. It has a lot of best practice around prescribing in general, and also looks at communications between prescribers and pharmacists and practice site considerations. We have some international examples, including a video on e-prescribing in the Ukraine. has a lot of practical clinical cases and interactive activities, and it's also available in French. So just to wrap up, a few comments on the lessons learned. Given the ever-changing world of digital health, we really recognized it was important to keep the e-resource relevant and up to date. And we had an active evaluation strategy, which included feedback from both students and from faculty. And this really helped us to identify areas that needed to be revised or expanded. And this was important for the success. And establishing our peer leader network and the informatics special interest group was also a key success factor. They both serve to connect with colleagues at their own faculties and support and mentor them so that they can integrate digital health into their curriculum. So thank you very much. Thank you, FIP, and also thanks to the many Canadian faculty members and their tremendous efforts in developing this resource. Please contact me if you want to know more information about the program. Thank you.
So thank you, Janet, for sharing the work undertaken and led by the Association of Faculties of Pharmacy of Canada from a conceptual framework development to support the pharmacy education institutions in Canada. Thank you, and for sharing also the detailed information about the different chapters. And now we move on to our last case example from Spain, and it's a pleasure to introduce a colleague who was with whom I shared the journey of the development of the FIP Digital Health and Pharmacy Education report. We were together on the core team. Jaime Acosta Gomez, who is a community pharmacist from Madrid in Spain and an active member of the community pharmacy section and the FIP Technology Forum. So on to you, Jaime.
Thank you very much, Lilian, for the very kind introduction and for having me today with colleagues from around the world. It's always exciting for me to feel that I'm part of a global pharmacy family, which in fact we are. And it's a pleasure for me to share with you my very personal experience trying to develop a postgraduate course on digital health in Madrid. First, a very brief introduction to you about the School of Pharmacy in the Complutense University. The Complutense University was founded in 1293, and that's not a typo. It's a very old university in Europe. The pharmacy school was founded in 1845. And I've had the pleasure of working with the Department of Pharmacology and Pharmacognosy, at the pharmacy school, which annually admits 400 students with a grade of almost 12 out of 14, more than 2,300 students with more than 300 teachers. The Complutense is the best school for pharmacy in Spain, and I'm a very proud graduate of that school too. In the next slide, I'll get a little bit more into the details of the program. So as I said before in the Q&A, I'm not an academic, I'm a practicing community pharmacist. And I felt also after being exposed with some FIP colleagues, especially, and I would like to thank her for her leadership and inspiration, Claudia Ricken. We had some conversations about the lack of digital health literacy in the pharmacy workforce, and I was very kindly invited to know more about their program in the Netherlands when they were developing it, and it provided me a lot of valuable information about the skills that pharmacy students and pharmacy graduates need in order to be a more complete professional by knowing better about digital health and using digital health in our regular practice. So we began pushing in the university from a very short summer course, 2-day program, from a full master involving the whole of the department, because it was very important to align everyone in the institution. So we did not want to leave anyone apart. Everyone that was interested in the matter was invited to participate. So we finally developed what I think is a very complete master, which will begin this September at last. And we will not only provide contents and knowledge about digital health and examples, but we will also provide knowledge about pharmaceutical care. Is the first module, as you can see there, with 42 credits, which is the biggest one. Then we'll have the digital health part with 23 credits. And then the pharmacoeconomics, because it's also very important, not only for the regular practice in pharmacy, how are medicines approved, and why pharmacy services compete with other technologies that are being reimbursed by the government. But also in terms of digital health, tools need to provide, most of them, efficiency. So we think it's a very complete program. And then we have an assignment in order to approve students. So these are on your left, what I would call the hardest digital health skills. I'm advisor to a digital health startup in Spain, and I advise a very big company in Spain also that provides digital health services to community pharmacies. And I think that this is super important, as I said before, in order that community pharmacies can trust the technology that they are using. Digital health by itself is nothing. It's only a tool to improve our service and the outcomes. So we provide what I call hard skills about virtual care, especially telemedicine, automation of information flow and chatbots, which are used also in the pandemic, and also in some pharmacies to provide some very basic answers to basic questions. So pharmacists have more time to provide more value and more complex things to patients. Also wearables and other devices for seamless and continuous monitoring. There are some technologies that allow pharmacists to receive an alert when a patient is out of rank of any, for example, hypertension, of diabetes, and patients are continuously monitored nowadays. Also the Internet of Things, the use of data, which is super important for our profession, because it's going to allow us to change our scope from curing illness to preventing it by using algorithms and big data. And pharmacy is a very data-rich environment. We should take more advantage of that. Digital therapeutics, modified reality to allow patients know how it's a very visual approach to let patients know how their drugs work and how their organs work and what they can expect from their medicines. Digital safety, which is super important nowadays in terms of trust. Now that we're implementing so many digital health tools, pharmacists need to be aware of not only law and regulation, which is also covered, of course, but how to trust digital health tools. And we also will provide some information, because these pharmacists are going to be the changers in the pharmacy landscape. And we are also providing them we'll provide them with some soft skills, which are super important: management and leadership, management of multidisciplinary teams. I'm very proud of the faculty that accepted to teach students. We have, most of them are pharmacists, but we also have lawyers, physicians, IT engineers, and the leaders of those teams need to know how to manage those teams well. And also communication, which is very important. And I think that it's not well covered in the regular pharmacy studies. It's a blended approach. So we have online and presential teaching, and also it's provided in Spanish and English. And lastly, in the next slide, some things that worked for us when pushing for this program to be approved. It was vital for us to have one of the team, someone in the team that was very experienced with the administrative matters. We presented the program, and of course it needs to cover some administrative things that are sometimes a bit complex and a bit tricky. It was very important for us to have someone that knew how these flows work. Post-degree internships are very important. The master, the cost is 3,500 euros. We will have some scholarships for students, but of course, being a postgraduate degree, pharmacists want to have this as an investment rather than as an expense. So we want to provide them with working opportunities after finishing this master. It's a blended approach, so we can have international faculty speakers. And we did some promotional things as 2 previous seminars in what we call the Health Week. Also, we provided seminars inside the faculty, and we also published with the department a chapter about digital health in the mandatory education resources for students. And lastly, to finish, I would like to especially thank Dr. Ruben Martin Lázaro, who has been very helpful through all the process and pushing for this to be a success. And of course, the head of the department, Juana Benedit, who accepted our ideas, and of course, all the rest of the staff that supported this idea to be a reality. Thank you for your time, and I'm ready for your questions, if any.
So thank you, Jaime, for sharing this experience from the Complutense University of Madrid, which now presents also the postgraduate initiatives that could help to support practitioners in the involvement of digital health competencies. And now here again, I would like to invite all our speakers to open up their cameras so we can have a final round of a Q&A session, and I'll pass it on to Gizem.
Thank you, Lilian. So I really thank all the speakers for their inspirational talks. So we have a few interesting questions. I would like to ask one of the questions, although Felicia answered it previously. I always saying thanks to all the speakers, what are the core areas for digital health relevance in pharmacy practice? I think this is a broad question, so I would like to bring this question into the table.
I think the first one, what I will say is communication. It's a different ball game of communication. So that is a clear competency. Maybe others can add. Yeah.
Yeah, if I could add, we actually developed, one of the initial stages was to develop a competency framework for digital health. And we had 3 different competencies: information knowledge management, professional and regulatory accountability, and information and communication technologies. And there's 31 different indicators under that. I did put it in the Q&A with the link to the report so people can see that. And then if you actually look at the 18 different chapters we developed, they're not all necessarily directly related to, like electronic health records, those types of things. But, we have even vaccines, because there's a lot of information on digitally available around that. We have clinical documentation, clinical communications, those types of things, drug information, that's all accessed digitally. So we've expanded our content not to just be things directly related to sort of electronic health systems.
So thank you, Janet.
I think just
Hello. Hello.
Yes.
Yes. I also want to include drug information is a key area for digital health application. Without drug information, the communication cannot be effected. So both pharmacists, pharmacy students, professionals need drug information, necessary apps such as Hippocrates, Medscape, and others that can help them to retrieve the right information for patient care and for implementing pharmaceutical care in the inpatient and even for outpatients. So we need competencies in that area also.
I just want to add last point, maybe a confirmation to what have been mentioned by the panelists. I think one of the maybe main area, the information management and assessment, because in the digital era, the management of the body of information is different. How we assess them, how maybe later, as Dr. Dixon mentioned, how to communicate them, to use them is a different scenario. So mine, I think the management and assessment of all the available information is maybe our most important digital competency regarding this point.
Yeah, another important thing I would like to mention here is that how you sensitize, because whatever the availability of data or whatever the platforms which are available, so you have to sensitize also. This is also one of the important parts.
Yeah, that's actually true. Because without the necessary sensitization, awareness of the availability of this information and management, it will be useless. So we need to sensitize and create awareness among the healthcare providers so that they can make good use of these apps and the digital health applications and competencies.
So if I may, it also apart from all that has been said, I think it's very important, and maybe it's not a formal element that has been considered, and it maybe should not be, but I think that we need to inspire pharmacists to transform our businesses. It's not about only, which is very important, receiving electronic prescriptions, which is transforming paper prescriptions into electronic. It's going one step further. It's not about doing a video chat with our patients, which is very important too and very convenient, but it's providing new business models to pharmacies that provide new digital services that can be run in automatic without the acting of the pharmacist. Or, I mean, we need to look further and we need to drive that change because it's coming. And we need to inspire and give the vision to our workforce that we can do much more, especially we lead the change.
Yeah, I believe that the comments, that's the core aspects are actually related to providing competencies in communication and in handling these platforms. And with the more recent reflection from Jaime that it's the way that we are performing, I would also like to put into perspective an area that we did not touch into so much in this webinar because of the broadness of the topic, but that in pharmacy education, we are also looking at preparing graduates for other areas that may not be the direct patient setting. We have graduates, especially depending also on the regions that we are looking at where we are working, where our graduates could be taking up leading positions in the pharma industry, in the regulatory perspective, where there again, digital health and how to have competencies to interpret the safety, the reliability, and the application of digital platforms as they interface with pharmaceutical processes is going to be also very important. So if we're looking at the core competencies, I think we need to also look at a very broad perspective and then apply it to our national and different course programs. I don't know, I would like to hand back again to Gizem. Maybe in the interest of time, if we have a burning question.
Yes, Lilian, we have one more interesting question from Latasha Wade. What professional development support do you provide to your faculty to ensure they are prepared to incorporate digital health in or throughout your pharmacy curricula, both didactic and experiential? Maybe you'd like to share our upcoming future projects, Lilian, about this issue.
Yes, I believe that, I mean, just some background, and maybe Nilan is in a better position to position this, but my thoughts are that actually FIP started working on this digital health and pharmacy education project before the pandemic. With the pandemic, we are seeing the more value of this opportunity, and the reports which we have shared earlier, and thank you to the colleagues on the panel who have shared their experiences, are a start of FIP initiatives that are targeted to provide platforms to educators to capture on skills, competencies, and keep on sharing these experiences as a platform for all of us. But I pass on this to Nilan.
Okay, thanks. Thank you, Lilian. So we touched upon this project multiple times. I think it's good to see great enthusiasm on what's upcoming as a result of the report. So FIP will be providing the masterclass to academics, educators on digital health. So we are planning to, that was a question as well, we are planning to launch the course around September this year. And this will be for FIP members. And at that course will be, I think that's going to be a professional development opportunity for educators, academics, so they can provide digital health education. And also we would like them, the participants of that masterclass, to become the change agents back in their countries, so they integrate digital health into their curriculum. So that there is another step there, how to include and integrate digital health into your curriculum. There comes our second project, which is not kicked off yet. So I'm not able to give a firm timeline, but we will give enough heads up when it's kicked off. We will also develop a global curriculum toolkit, building on the case studies that our colleagues have presented today. So you will have a step-by-step guidance on how to integrate digital health in your curriculum, what kind of resources you can use, etc. And there may be also good practices, good examples from our speakers today, because we've seen that they provided digital literacy skills to their educators, which was a success factor for many of the case studies. I hope this has been a good answer.
And also I may add that on the 19th of May, the FIP academic section will be organizing a town hall session. You will receive information from FIP about it, and there again you may learn about the exciting project coming up with regards to the masterclass for the digital skills in pharmacy education. So keep following. There are many initiatives coming up from FIP that will provide more information about these projects.
You are muted, Lilian.
Sorry, so I believe that in the interest of time, we need to move on to wrap up the session. It has been an exposure of how much we can learn from each other and how much powerful the tool to share experiences and reflect on the experiences of others, which we can then discuss within our teams. The literacy of pharmacy educators, practitioners, and students is an ongoing experience that we are looking at, but our target is to maintain this continuity of momentum. Maybe we can have the next slide to see the drivers that are going to maintain this momentum, that we can maintain the continuity in instilling change makers in the educator platform and in the practitioner platform. With, as we have seen during this very interactive discussion, all of us being very focused to learn what are the core competencies, but we have very good examples. Today we have shared a snapshot of the examples. I'm sure there are many out there. So I do encourage that we share experiences, network, so as to move on to develop a digitally empowered, patient-focused pharmacy curricula in our schools of pharmacy. And therefore I'd like to thank you all for joining me. It's been an experience where I learned a lot from the experience shared from our 7 speakers, and I do look forward to have other ideas coming up as we share these experiences. In the next slide, before I leave you on again in the good hands of Gizem, I'd like to emphasize that by sharing, networking on a global level, we are empowering ourselves, our team, in spearheading transformation in pharmacy education. And therefore, I would like to call on the leaderships of pharmacy schools to consider joining the FIP Academic Institutional Membership, the AIM group within FIP, where also from that perspective, initiatives to network, share ideas of transformation in pharmacy education are always coming up. So I'd like to put in this reminder for you to update your membership at that level too. It's been a pleasure, and thank you FIP, Nilan and Gizem for sharing this platform with me, and I'm really humbled to have been able to witness these success stories from our 7 speakers. That's all from my end. Thank you.
Thank you so much. We appreciate you all. It's been wonderful. Thank you.
Thank you, Lilian, and I'm continuing to finalizing the webinar. So I would like to sincerely thank our moderators, speakers, and our colleagues joining us all over the world. The recording will be made available on www.fip.org. This is an opportunity for me to invite you check all future FIP digital events on events.fip.org. Please give us your feedback to webinars@fip.org so we may continue to improve our quality. So there are a series of digital events about the FIP development goals that Nilhan mentioned in the beginning of the webinar. Please stay tuned as our next event on the 20th May, which will be covering FIP Development Goal 20 on digital health. This development goal is very important, as you understood from this webinar, so timely. So please don't forget to register. Our second next event will be on the 27th May, titled Community Pharmacy Regulation, Access and Remuneration, Global Trends in the Digital Health Innovating Pharmacy for the Future series. And the third one will be on 22nd June, that has been titled Distribution of Medicines and Promotion of Responsible Self-Care, Channels, Changes and Challenges. Please don't forget to register, all of them. We are looking forward to sharing the platform with you. Thank you for attending today.
Thank you. We appreciate you all.
Thank you.
Thank you.
Thank you, everyone.
Thank you so much. Bye-bye.
Bye.
Bye.
Bye-bye.
Thank you so much.
Thank you.